I'm going to talk about Takotsubo syndrome. As you can see from the first slide, it does say Takotsubo cardiomyopathy if you just remove the cardiomyopathy part. So Takotsubo syndrome is sometimes referred to as a cardiomyopathy. However, it is classed as a transient change. So that means it's a short-lived change to the left ventricle, which is the main pumping chamber of the heart. It can last for a few days to a few weeks, and it's now known as a syndrome rather than a cardiomyopathy, but people will refer to it as Takotsubo cardiomyopathy and Takotsubo syndrome, and those are sort of interchangeable. For many people, the symptoms mimic a heart attack, so precipitated for some people by a stressful event, and it's diagnosed when coronary angiography, so that's a special heart catheter that's put through the wrist or through the groin, and then that's to look at narrowings to the heart arteries that can cause blockages in the heart artery. So they're looking for the potential of a heart attack or a severe angina attack. So that's what they do with the coronary angiography. It normally shows in people with a Takotsubo syndrome a clear coronary artery, so none of the coronary arteries are narrowed or furred up enough to cause a heart attack or a severe angina attack. But it does show a ballooning of the left ventricle, which is the main pumping chamber of the heart. So the ballooning of the ventricle can lead to the inability, so the heart can't pump as well as it could before, and some people will get symptoms, and we'll talk about the symptoms in a minute. So symptoms that are looked at and umbrella terms as heart failure, so when the heart can't pump as well as it needs to supply the brain and body with the blood and oxygen that it needs. And the acute heart failure, so heart failure has its own specific symptoms. As I said, we'll talk about that in a minute. In the weeks after onset, the main pumping chamber, so the left ventricle, gradually improves its function. And so in order, people will then start to have less symptoms and to feel better from a symptom point of view. Some people will continue to have some symptoms, and I do speak to people with a Takotsubo syndrome who continue to have symptoms after the initial event. So as I said, majority of people who go into hospital with symptoms very much like a heart attack, which could be chest pain, breathlessness, feeling dizzy, collapsing, feeling like very unwell at the time of admission. ECG, so they do an electrical tracing of the heart, and for many people that shows changes on the electrical conduction within the heart that look like a heart attack, hence why a lot of people are treated as if they've had a heart attack. Coronary angiography is what they would do straight away for someone they suspected a heart attack, and that's important to do that very quickly. And then when they look at the heart arteries that supply the heart muscle with blood, they find that they are normal or within normal, that wouldn't cause a heart attack. And therefore, when they look at the actual pumping chamber, the left ventricle of the heart, they see a typical ballooning of the main pumping chamber. And then a diagnosis of Takotsubo syndrome is usually made. Try and change that. Okay. So I've put here some of the symptoms that people will still have post initial event, and these symptoms can be similar to symptoms that people will go into hospital for. And the percentages are from a research study that was published in 2018, looking at symptoms that people say they have once they've been diagnosed with Takotsubo syndrome. So Takotsubo is described, as I said, as an acute onset syndrome with a rapid and spontaneous recovery. So recovery quite quickly for many people, and the heart muscle pump, so the left ventricle, starts to go back to normal fairly quickly. However, longer term symptoms aren't always discussed or very well defined. So not everyone will know what those symptoms will be. But certainly from talking to people on our helpline and through email and through these groups, we certainly know that people will continue to have some symptoms. So, as I say, researchers identified that many patients will have persistent symptoms that can limit how they live once they're discharged from hospital, and can reduce the amount of activity and exercise that they can do after they've been discharged. And the research looks like it's a change to the structure of the cardiac muscle from the original event, and also to do with specific metabolic changes in the heart muscle. So the way the heart muscle works has been affected from the syndrome itself. So symptoms post-diagnosis can, for some people, have certainly a fatigue. So many people will talk about an overwhelming tiredness. So not just a tiredness where you can have a sleep and you feel much better. It's more like sort of an overwhelming exhaustion feeling, which is described as fatigue. And that's been noted in 74% of the research studies respondents to the symptom question. Shortness of breath, so feeling breathless. Some people will get that at rest, and some people will get that on exertion, so when they're moving around. And that was in 43%, so just under half of people post-diagnosis continue to feel breathless afterwards. Palpitations, which some people will describe as a fluttering or a feeling of beats or missed beats within their chest. And that was a fairly low 8%. But still, some people do have those symptoms. Chest pain, again, was a small percentage of people that have a residual chest pain. And then, as I've said, sort of a reduced ability to continue to be active or to exercise post-diagnosis. And so some of the symptoms, so shortness of breath, the palpitations, the fatigue, and some to do with chest pain, can be within that sort of heart failure type amount of symptoms for them. And the likely explanation was certainly a physical symptom, so it wasn't necessarily an emotional symptom that they felt they had, but it was actually a physical symptoms that people were having. And a likely explanation for those ongoing symptoms were changes that happen within the bottom of the left ventricle, what they call the apex, so the very bottom of the left main pumping chamber of the heart. So when the left ventricle contracts, it moves in what they call a ringing motion. So it rings out the blood up through into the body and the brain. And there was a change to the ability to the heart to twist at the very bottom and to eject all of the blood within that main pumping chamber. They also, from research, it looks like there's a possibility of an imbalance between a specific type of metabolism and cardiac function. So that's looking very specifically at the cardiac cells. And they note that because the left ventricle, so the main pumping chamber of the heart, recovers in many people quite quickly, many cardiologists and medical professionals believe that Takotsubo syndrome is a very transient, so lasting for just a short amount of time. Whereas the research that's being done into Takotsubo syndrome would indicate that actually longer term, many people do still continue to have ongoing symptoms. And for some, that can have an effect on quality of life. So I think a recognition that some people will continue to have some symptoms after they've been discharged from hospital, when their scan shows that the left ventricle has gone back to a normal shape and size. There may be some evidence of changes within the heart muscle cells that can cause these ongoing symptoms. So what can trigger a Takotsubo event? And this wasn't necessarily a question that was asked, but on the helpline and at these group meetings, there are people that will say that, they don't know what triggered it for them. And just sort of research-wise, it was quite interesting to read that an emotional or physical stress in the preceding hours or days before a Takotsubo syndrome event can happen in around 70% of people, so not everyone. And around a third of people have no identifiable trigger that could have caused their Takotsubo syndrome. And I think that's really important for lots of people to know that it's not anything they've done particularly, and if people can't work out exactly what triggered the syndrome event, then that you're not in a minority. There are a number of people that don't know what has caused that. So physical and emotional triggers can vary in nature. So for some people, some of the triggers can be, what are perceived as, a very trivial event, but they might not be for that individual who's had that trigger. And it may be, quite significant for them. So it's a very personal thing as to what could have, triggered that event. It could be, loss of a personal item that's caused a great stress. It could be a life-changing event, so a death of a loved one, and death of a pet as well can be a trigger for the Takotsubo syndrome. And it can also be triggered by a positive emotional event, such as winning a prize, or happiness at a celebration, a family reunion, someone you haven't seen for a number of years, or a wedding, or a significant birthday can bring on a Takotsubo event. So that can be a trigger as well. There could be a loss of an income, loss of a job, or loss of home. It could be a bereavement, and that obviously, would be significant for many people. It could be an argument, it could be a harassment, and it could be an illness of a loved one, or a physical accident, or a fall, an illness, or surgery. So there can be lots of different reasons. And then, for some people, there just isn't necessarily a trigger that they can identify. And, as I said, that's not because, you can't work out what it is, but it's just that for some people, there just isn't a trigger. The event just happens. So one of the questions we had was around how can you explain to loved ones, and I put loved ones, and I mean family, friends, close people that are close to you. So how can you, tell people that you've got this condition, that this syndrome, and how do you talk it through? And I'd like to, maybe think about us, talking that through once I've finished speaking, and to see how individuals told family and friends. And certainly there are resources on our website. There's resources on takotsubo.net as well, which is a really good website to talk around Takotsubo syndrome. So sometimes people will share signals that they're ready to talk. Sometimes they might not be ready to talk. So this is obviously yourself, or family members might not be ready to talk. They might be worried or scared around your well-being or their own. They might ask you instead to spend time with them, to do things with them. And some people might act quite nervous because they're not sure what to say. They know you've been in hospital and you've been quite unwell. They don't know whether to ask you, or and it may be that you have to sort of start that conversation. And some people will make sort of jokes that aren't particularly funny, but it's their sort of way of trying to introduce the conversation with you. So sometimes it's around sort of just having that time, whether it's going out for a meal, sitting down, and just chatting generally, and seeing if someone's open to you discussing it with them. Loved ones want to perhaps be understanding and help you with everyday things and be involved in your world, but they may not know quite how to go about that, and some might be worried that that they're not sure that you're going to be happy with them helping you out. And so I think it's just trying to open those conversations. Some people, individuals, will hide their feelings. They're very close. They keep things very close to themselves. And other people will want to talk things through, show their feelings, and might actually be openly, upset or worried. So I think it will vary from person to person, how they express themselves. Some will be very unique in the way that they want to have the conversations with you. So I think it's just being open and aware, as well as trying to obviously support yourself. Helping you sort of, talk. Sometimes there'll be support groups, so like our support groups online, or there might be local support groups where you can go and talk. The nurses here will certainly listen, advise and support. And we can certainly talk if you're not sure how to approach loved ones. We can certainly talk that through and have some ideas and thoughts around any conversations that you're finding difficult. And also we have a heart-to-heart, so a peer support service where you can talk one-to-one someone else diagnosed with Takotsubo syndrome to maybe sort of get their idea about how they, you know, spoke to family members or loved ones. And certainly, you know, talking, you know, around telling your story can be very therapeutic for some people. It can really help. And certainly some, you know, researchers looked at that being a very therapeutic way of talking around, you know, Takotsubo syndrome and other you know, medical conditions. So certainly, you know, talking to someone who can understand, and that's obviously why we run the groups that we run, you know, can certainly help with having conversations with loved ones and family members. And I've just put some information up here around being an expert patient. So this was some information that the nurses wrote for a My Life magazine, and that can be found on our website. If you put My Life, then certain, you know, My Life will come up and you can read the information on there. So having information, so, you know, coming to meetings, going to conferences, listening to the YouTube, looking on the website for information, you know, is certainly fundamental for many people in sort of empowerment. So that's having lots of information that you understand, and being informed around your condition can really help people to feel that they can talk around their condition more openly. And certainly when you're talking, you know, to healthcare professionals, having an understanding of your condition, you know, talking to other people, knowing that you're not alone can really help people feel more empowered and feeling that, you know, they have can have a conversation, you know, around their condition, how it affects them, how they feel, and what sort of things they want to know from medical professionals. So, you know, for instance, medication treatment, you know, why are you being prescribed a certain medication? What is that medication going to do? You know, what's important about that medication that you need to know? So I think, you know, having that knowledge, you know, education around your condition can really help, and attending support groups, talking to the nurses here, looking at information can certainly, you know, help people to feel empowered and feel that they're not alone when they're, you know, living with Takotsubo syndrome. So I just want to mention as well around emotional well-being. So it can be really important for many people. It's not a question that was asked around emotional well-being, but I wanted just to mention it really about, you know, having a condition diagnosed, being acutely unwell, you know, can be, you know, the physical impact of that condition, you know, if you've had pain or if it's limiting your activities, such as managing medication or you know, having, you know, side effects of medication or driving, work, you know, leisure activities. You know, it can be important to make sure that your family friends, whether, you know, you're getting that support from sort of heart to heart, so peer support group, or from the nurses. You know, and it can be, you know, important for many people to make sure that they are, you know, supporting themselves and supporting, you know, via, you know, our support groups, etc., so that they are getting that sort of support when, you know, when they have had, you know, a condition that's been diagnosed and that they've been in hospital, you know, and they've been feeling unwell.